Hi, it's Dr. Dan Purser. Welcome to our Facebook Live, danpursermd.com. You can find me there. Also, you can find me here in my office. Whoa.
Sorry.
Earthquake.
Sorry.
Right then, just is really
Small
doing
earthquake.
Okay. Small earthquake. Really quick. Tonight we have a lot of new information. One is Brecken is moving up. You're going to be our new,
Let's hear the name you made up for me.
Intellectual property coordinator, supervisor, and over sales and distribution and website prominence. Or is it provenance?
Providence.
I don't know. You
Providence.
tell me.
Okay. Well, wow.
I'm just going along for the ride.
Got it. And taking her place, moving in to her place is Kelsey, I now work for Kelsey. I was working for Brecken. Now I work for Kelsey. Kelsey's the office coordinator manager over me, Brandy, and Carly. And who else? Do we have anyone else?
Everyone else. Kelsey's now in charge.
Oh, you guys are too
Kelsey's
kind.
in charge. Speak closer to the mic, Kelsey.
Oh, hi everyone. I am very excited to be a part of the team and get to know everybody. And we're going to have a good time.
Eventually, we'll get a face reveal from her too. But just like me and Jackson, we got to build it up.
It's a
Gotta earn
mystery.
Yep.
It is a mystery. We've known Kelsey for a long time. And she's a good hand. She was a major force where she worked prior to this. We stole her away from them. They're still hunting for her, but we stole her, so they can't find her. But hopefully they won't listen to my Facebook Live. Also thyroid panel sale going on
Direct Labs.
Direct Labs. You're going to post all that on Facebook?
I already did, this morning.
You guys need to jump on that. That is cheap. That $49 and $139 is dirt cheap for antibodies and full FT3, FT4, TSH.
Yeah.
You need to get those. I'd say everyone get those that think they have a thyroid problem or is on thyroid, because I'll need that information. And even if it's 3 months from now, I'll use it. So if we're trying to figure out where your dose was.
Kind of in relation to that, because someone asked a question on that post. Would they need to get that test if they have Graves' disease, or does that not?
Yeah, no, that would help too. Yeah,
so get
definitely.
that.
Oh yeah, Graves. Yeah, absolutely. That you'd want to get the full one. It's $139, which is like really 70% off from what everyone charges for it, which is ridiculous.
Direct Labs is really nice too, because you don't need a prescription from a doctor. You do it yourself.
Pay with your credit card and go get it done.
Mm-hmm.
You don't even need to order it. It puts the power in your hands, which you guys like.
Yeah.
I know you love that, because you don't want some schmucky doctor like me telling you what to get, what you can't get, how to get it, what you need, what you don't need. And we do that. Oh, I try not to do that, but some of us do that. So can you hear me all right?
Yep, I can.
Should I pull the mic closer?
Nope, you sound great.
What if I start singing?
I would love that.
You should do that.
Whoa. We still need to get our theme song.
I was moving the Columbo away so you wouldn't see.
I saw your hand. It's a kalimba.
Yep.
Boy, you had a little curl there. I think. Okay, that was pretty good.
Hey, that was my first round of applause.
Was
Wonderful.
that's the Star Wars theme song?
A Star theme song, yes.
What do you change it? You change it every week.
It's been the same for this whole year.
I played Star Wars one time on it.
You did? I thought it was multiple times.
Maybe once or twice.
I thought once you played A Star Is Born.
That was the Christmas episode.
Sure.
No, what is that? Is there a Star song for Christmas?
Yes.
I want you working on that, Jackson.
For Christmas, all right.
And Jared can play the trombone and accompany you.
Sounds good.
Because he'll
We'll
be
work
back
on that.
from medical school, right?
Mm-hmm.
So Jared's doing really well in medical school.
Yeah.
And he's blinking like straight A's.
He's doing good. He's very much high up in his class. He's working very hard with it all.
And he's not dating anyone, right? Not that we know of. He's kind of a secret dater.
Focuses so much on school that he doesn't date at all.
Or he's
I know
dating
nothing
his school.
about that.
He wouldn't tell us even if he was dating someone, would he?
No.
Probably not.
Little secret, little dater. How dare you do that to your parents, Jared? Okay. Okay. So Jackson, are you a secret dater too?
No.
I think you are.
I love how much we bring this up on
Brecken was
every other
Brecken was a
Facebook
secret dater. Then one day she came in and said, "I'm getting married."
That's kind of what happened. You love that though.
Yeah, he's a super nice guy. So okay, so this is the Stump the Doctor Purser episode number 1 because we're going to do these some more over the next 10 years. You think we'll do more?
Yeah.
Sure.
Well, man, I'm gonna have a long lifespan.
Stump you till you're dead.
at this gig. Yeah, you guys are working me till I die. I know that's in my contract now. I work till death. So, so anything else I need to cover? Oh, spectre cells. So they're having the same problems all of us are having. They're having trouble getting their tubes, which is a nightmare.
Yeah, we've never had this issue before.
We never have, but now with they can't get the right size
lot
glass
of-
tubes.
Yeah,
and-
manufacturing's just delayed, and they got
yeah, we know how that goes.
when they keep giving us hope and we don't get it. So we're getting closer, guys. We've been talking closely with them, and we're almost there. So those of you who are waiting, just if you have more
We're
questions,
so sorry. Yeah, we've never had this problem before.
Yeah.
Usually we get 60 orders. We can
right that we can get it
contact
that
them and they'll
day.
send us 60 spectre cells
Yeah.
a few days later.
Yeah,
They've
so
UPS them in their hair. Yeah.
it's just
This
the
is
way.
weird. I'm so sorry.
Yeah.
Not our intent. Never was. Okay. Should we start answering questions? They like it when we get right to it.
Oh yeah.
Let's do it. Okay.
Will Kelsey help me on some of these questions?
Yeah. she can
Oh,
read them.
sure.
So I'm just pulling from those posts that you had, and then I'll also be pulling from the comments that you guys are making here, and we'll just go from there. So first off, what supplement or medical condition could cause an elevated B12 level, which is like over 2,000 in a 40-year-old female?
So there are at least five types of B12. And your lab equipment doesn't differentiate. The lab equipment your doctors are using doesn't specifically differentiate between the 5 kinds of B12. I don't know what kind of B12 that is. It's elevated. But it's probably maybe the most synthetic form of cyanocobalamin because people with MTHFR cannot absorb that. It might be methyl B12. I doubt it. Probably could be adenosine or hydroxy.
So to follow up a little bit, also she put her B12 levels are usually low, so she started taking methylated B12 dissolvable tablet each morning, and she's been on the same dosage for 2 years, and like just suddenly it skyrocketed.
Yeah, she filled all her cells up.
So she's
Back it off. Yeah, it'll go back down. If it doesn't, you can donate blood, and it'll go down. Then someone will be really happy to get your blood.
Do you think
All
if
that
she
B12 in it.
did like a spectre cell, you would find a different result? Because I know sometimes B12 can't get absorbed into the cells properly if you're
Yeah,
not
you
taking-
often do. They can have a super high blood level of
Yeah.
a serum level of B12, and you get a low intracellular level of B12 because they're genetically missing receptors
Yeah.
to absorb that B12. So
Because like you said, there's different ones like adenosine, hydroxy, you could be
cyano,
taking the wrong
methyl,
one.
yeah, you can go on and
Yeah.
on.
Yeah. So,
Yeah, spectre cell doesn't differentiate between the kinds of B12 either.
gotcha.
So
little rough.
I know there are tests out there that you could use, but they're just incredibly expensive and not
Yeah.
worth it.
So,
So
back
do you,
off a little.
do you like my lucky hat?
Yeah.
Or my lucky
There's
hat?
been a couple comments in there. People are happy about seeing
Yeah,
it.
okay, good. It's my lucky hat. That way I don't miss any answers.
Well, that's
There
good.
you go.
So
'Cause
you won't
if
get
someone
stumped.
really stumps me, they're going to win the prize. Or we'll pick the best question.
Hmm.
So what is the best thing to keep inflammation down in the body?
Oh, that is super complicated. There's
Stumped
so many
already?
causes of gross inflammation in the body. You think about it, you could have RA, you could have osteoarthritis, you could have rheumatoid arthritis, you could have all kinds of other inflammatory conditions, or you could just have a bunch of genetic errors that cause inflammation. You maybe don't make enough SOD, superoxide dismutase. That'd be SOD2 or SOD3. If you had SOD1, you'd have ALS. So you know if you had SOD1 error, but lack of glutathione will cause inflammation. Any of the super antioxidants like glutathione or like SOD can dramatically reduce inflammation, though, and maybe you're not making enough of those. I'll tend to use those plus resveratrol, a trans resveratrol. We're working on improving that version of that, but the Designs for Health has a validated trans resveratrol and quercetin that's really good for reducing inflammation. I think it's called resveratrol supreme. You only take one a day, and that can help a lot with inflammation. So it's what I take. I have a lot of inflammation too. Also, having a metal toxicity like a copper toxicity, like say you'd seen fibromyalgia, can cause inflammation.
Yeah.
Okay, that's
Great.
good.
Yeah.
We may go for an hour tonight.
There's one other really great anti-inflammatory product. I know you don't like tooting your own horn sometimes, but Arvar's glutathione is quite an extraordinary anti-inflammatory.
Well, it's the only validated glutathione in the world, and we have U.S. pharma patents, Japanese pharma patents, and other pharmaceutical patents on it. It's the real deal. We're really proud of it. And it one of its jobs, one of glutathione's jobs, is to remove inflammatory cytokines, anything toxic that's causing inflammation, stuff like that. So yeah, you can rub it on muscles too and stuff, topical. See if it doesn't bring down your inflammation.
Yeah.
It usually does.
This person's vitamin D is low.
Well, I'm going to say one other thing.
Yeah.
We're going to come out with something in the next 3 or 4 months that's pretty earth-shattering for inflammation. It's off the charts. So it's all natural. It's good for your kidneys, your liver, your heart, your eyes, your blood vessels, your spleen, whatever. It's good for your joints. It's another super antioxidant. And some of you already know what it is. And because you've been in our studies with it. So it's pretty awesome. It's really 5-star. You'll wait until you try it. So, okay. That's all I'm going to say.
Yeah, really exciting. This person's vitamin D is low. In the past, they would be prescribed a very high dosage of vitamin D, and their whole jaw would hurt. Do you know why that would happen?
Yeah, it could be a stimulation problem or malacia, MALACIA or something like that in her jaw, or maybe she's got kind of osteoporosis problem in her jaw, and she's rebuilding it when she takes that much vitamin D. I don't know exactly how her jaw was hurting or when it hurt,
Yeah.
or how it hurt, or so I'm not quite clear how to answer that.
Yeah.
So
That's always the hard part with some of these questions.
it's
Is
not stumping me. It's just not. I don't have enough
information.
information. Yeah.
halfway stumped.
Right. Well, I'm kind of stumpy. I'm not real tall. I'm 5'11".
We can call him Dr. Stumpy.
5'10", 5'11". Hey, Dr. Stumpy.
You're 5'10".
Yeah, 5'10", 5'11". I used to be 5'11", a little over. I think I'm shrinking. I know after my wreck in 2001, I
Yeah.
definitely shrank.
It's interesting.
Yeah.
This woman, she has PCOS, and she gets foot, toe, and ankle cramps mostly during her cycle. Would the magnesium help? Or
Magnesium, chelated or glycinated magnesium.
Oh.
I take the glycinate, magnesium glycinate from, maybe it's a chelate, I can't remember, from Designs for Health. That's a really, really good one. I take 2 a day, maybe 3 for a while until those cramps go away. But it's almost always like a magnesium. And be careful, don't do a magnesium oxide, that'll give you the diarrhea.
Yeah, that was like a question: is what's the best magnesium to take? So
A glycinate, a chelate, a bisglycinate. Those are usually the best ones.
and what's the one to avoid?
Oxide.
Oxide. Okay.
Because that's what it causes stools.
Fun.
Icky.
I'm sorry. I have a little bit of a cough. What causes an anxiety-like feeling when having to empty your bowels? Also only happens when she's on her cycle. And then after that, she gets really thirsty.
Could be lacking progesterone. Progesterone calms women down. Around the time of your cycle, you should have a big surge of it, but some women don't. Maybe you have a little endometriosis going on. Your bowels feel loose and and they're inflamed. I don't know. I'm just kind of guessing from the little bit of information you sent, but I think it's less. I'd attack it through progesterone first, and you know your options for that. Support that. Progesterone Plus. We make a product also for Designs for Health. If you're not a Young Living distributor, it's called Progesterone, which is a completely different kind of product, but it's still, they both are natural progesterone supporting products.
Yeah.
Or get your local doctor to prescribe you bioidentical progesterone. You see, but I don't. If you think you might have mild or moderate or even severe endometriosis, it's almost always the answer.
Totally.
I've seen a couple questions on here that basically are just asking like, well, how do I know what levels or how much of a certain supplement should I take to know that I'm taking a healthy amount?
Boy.
Yeah, it's a good question.
Well, that's a really good question because at that conference at the AMMG conference in when was that, June
In Miami,
in Miami that I spoke at, was it June?
May or June? Yeah.
No, it was May, into May. Yeah. I answered that question on the last day. It had been running through the entire conference, and I'd watched it, and I thought, it's a real problem doctors and practitioners and patients are having. How do you know if you're getting a therapeutic dose of a particular product? You don't. We're trying to answer that. This is a biotech we created, and it's basically around stuff like that. We're going to answer those questions for you because no one knows if you get a really pure, reduced, stable form of an antioxidant, how much of it is therapeutic or not. No one's ever had that before. We have in our glutathione, we have in some other stuff we're developing and have developed. And we're going to come out with a whole line of antioxidants that have those kind of processes that they've been created through. So we'll be able to know exactly how much you're getting, and you'll know if it helps or not. Most of the antioxidants we've dealt with are incredible. When you handle them correctly, their benefits are extremely noticeable and off the charts. It's like the glutathione. It's crazy how well they work. I know there's a number of articles out there that say that antioxidants have failed. You can Google that. Antioxidants haven't been what everyone thought they would be. The antioxidant era is over. They've disappointed, blah, 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 all that. In reality, we've disappointed antioxidants because we have not handled them correctly. So, and the job of this biotech, this biologics pharmaceutical company we created, is to change that. So,
it's very exciting.
Yeah,
A lot of fun stuff going on with it.
we get caught in the mundanity of it all, just trying to get products developed into market.
Yeah, we're very close. We are so close to getting our first couple out.
Yeah.
It'll be very fun. Kind of going back to my question, maybe I was trying to lead an answer too much, but maybe a great thing to explain is a great baseline to understand where you're at with vitamin deficiencies is a spectre cell.
Oh yeah, good point. Yeah. Well, yeah, you know if it's therapeutic or not by and that's again I make certain suggestions because I've worked with certain products enough to know that they will affect your spectre cell. Spectre cell is an intracellular vitamin, mineral, amino acid panel, but what gets into your cells mostly is determined by your genetics. So if you have genetic errors, some of them will mean you don't have enough receptors for folate or enough receptors for B12 or enough receptors for selenium or whatever. It just goes on. And or you can't handle them correctly or you can't absorb them correctly at a cellular level for a number of reasons like MTHFR. And spectre cell will show me that. I call them footprints, but like if I see a B12 pentophenate, serine, deficiency, maybe folate 2 in there, it's for sure it's MTHFR.
Mm-hmm.
I've seen it hundreds of times, thousands, I'd say now. Mm-hmm. So
it's always funny to me because we'll give him a spectre cells to look at, for the day because we get people every day, and he'll look at it and he'll just know exactly MTHFR and he'll like write it on.
We
there.
do a spectre cell one of these a few weeks ago.
Yeah,
look at that. Watch that one.
Because
YouTube.
He knows by looking at it because there's so many similarities with people.
Yeah, your genetics, like a 23andMe or a Pro7 or methylation foundation methylation support genetic test that we developed. It's reflected in your spectre cell, and it just further confirms that you're not absorbing B vitamins and you're exhausted, you're tired, you're beat up, feeling can't sleep, but you're exhausted all day at work, and you're wondering how you're going to make it through every day. that's when you need a spectral cell, maybe some genetic testing, and we'll dial it in. It's what I do. I get them. That's the majority of my patients. They're just tired. It's so weird that here at 61, I'm dealing with patients who are just tired, immensely, overtly exhausted. And it's a big problem.
And with that fatigue, most likely comes anxiety and depression.
Yeah.
But you don't have to live with that. That's the amazing thing. That is truly what's amazing. What you've cracked with this, looking at the genetics and vitamin deficiencies, you don't have to continue living that way. There are some simple changes you can do and get on your way.
And usually, I know patients kind of often cry when I'm like, yeah, when 50 days, when I call you back, you're going to be quite a bit better. But 100 days, it takes 100 days to modify those intracellular numbers or to get rid of those deficiencies. And you're going to be dramatically better at 120 days, somewhere in there.
I saw a couple times this question talking about insulin resistance. Is there anything basic you want to share about that?
Yeah, we deal with that a lot. It shows up on spectral cell often. Probably I get one or two of those a day I look at. So lack of selenium, lack of chromium, zinc, B12, and folate, and some other B vitamins. Biotin too will affect your insulin receptor functionality. Lack of fish oil, olive oil will affect your insulin receptor functionality, and it shows up on spectral cells, the test they look for. And I often get type 2 diabetics. The newer, the better. But I've even taken some that have had it for 3 or 4 years. And you get a spectral cell on them, you find out they have a horrible, wow, how are they alive? Chromium deficiency and a really bad zinc deficiency. No wonder they can't. Their insulin receptors don't work. Surprised they're even there or the patient's even alive. But you fix that problem and their insulin receptors recover and go back to work.
Yeah.
So I'm not curing diabetes. I can never do that, but I can unwind the vitamin deficiencies that cause the insulin resistance or insulin receptor dysfunction. So insulin resistance is a simplified word that doctors use for insulin receptor dysfunction. When I speak at big conferences, that's one of the questions. If that's near my topic, I'll ask. So what is insulin resistance? And all kinds of doctors will try to answer it. And no one ever quite gets it. They're like, your insulin doesn't work right. I'm like, why? And they go, I don't know. And so it's just something that's defective about your insulin. That's usually the most common answers I get on it. Well, your insulin's fine. It's your receptor on the cell surface. You have hundreds of them on every cell. They're not functioning correctly. And they think I'm like really complex Mercedes engines, and they purr along if they're functioning fine. They take the insulin comes in and turns them on, opens them up, and sugar can go into your cell, carbohydrates, because then it can be altered to form AMP. It goes through the Krebs cycle, the citric acid cycle, all that in your mitochondria, and out comes the ATP. And if your insulin receptor is not working correctly, you won't create much ATP. You'll be tired all the time. You'll be hungry all the time, and you won't be able to get sugar into your cells. Instead, it causes havoc in the periphery. But anyway, that's insulin resistance. That's insulin receptor dysfunction.
Yeah, I've seen this question a couple times, so we can just answer it real quick. With spectre cells, when you're getting it done, you don't want to stop taking your supplements.
Doesn't matter.
Just kind of make note of it and see if it affects it. Like you can tell them, yeah.
Yeah, it takes 100 days to change that. Yeah, if you stop 100 days before we do the test, yeah, it might make a difference.
Yeah, but you don't want to stop everything 100 days before.
Yeah, I know, keep going on everything.
So, yeah. Can rosacea be caused by a nutrient deficiency? That was an interesting one.
I don't think so.
Okay.
Looked at it. I even got a little bit of it sometimes in my cheeks, but I think it's just from overindulging in carbohydrates. Maybe, I don't know.
I would say a lot of people's MTHFR tend to run with redder skin. Like you just get red faster. I've noticed that with patients and stuff. Myself too.
That's anecdotal.
Well, It is what it is. Just my opinion.
I had a lot of really pale patients with MTHFR
Yeah.
because
Mhm.
they're vitamin D
I think that makes
deficiency.
sense
Mhm.
too.
Oh, okay,
Hey-
we'll agree to disagree on that.
I keep getting a lot of questions about COVID. I don't know if we really want to delve into it too much.
Yeah, I can't believe you said that word.
It's okay.
Now our video gets shut
No,
down.
it's okay. It's fine.
We're at a different place than last year. Hopefully.
I don't know. I'd say we're not.
No,
We're not touching that.
So, if anything, though, if people have questions, maybe contact our office. We can chat with them one-on-one, not necessarily on Facebook Live. Yeah.
'Cause there's a lot of people, but just reach out to our office so we can keep it.
Yeah, we're not going to mention that again.
Yeah.
Just because also the death threats and everything else gets kind of weird if I even discuss it.
So going into that, anxiety. This is something that a million people were asking about. And I know that's something that you have a lot of different protocols. Specifically, I saw a lot for children. And then also just for people who've been dealing with their whole lives. They have MTHFR, they don't have, everyone's
Pro
kind of different.
7's the answer. That Pro 7, it should be called anxiety genetics because it looks a lot at 4 different genetic errors that cause anxiety. And it's so easy to do it and to get it. Or if you've got a 23andMe and can get me a NutraHacker complete, I'll take that too. It's not as exact. It doesn't quite look at some of the same things, but I can scan through it and find similar type stuff. But there are a number of anxiety genetics that have easy workarounds. Like I don't make enough GABA because I have GAD1 errors. I also have ATG16L1 errors. You can look these up. But the GAD1 error, you don't make enough GABA, which is a natural benzodiazepine that you make in your brain. And I don't make it. So I have to take GABA. Or I don't have to, but I choose to take GABA at night to help me calm my brain down. I took some today at a movie because it was causing me stress. Well, sitting there, and I like to work and move around and keep busy. So sitting down for a little while wigs me out sometimes. The movie is kind of boring.
How dare you?
What?
I love that movie.
Sorry.
I was sitting right next to him. I'm going to tell a funny story. Because, and you don't know this, but I saw Dr. Purser fell asleep during the movie.
I did it. It was
And
boring.
the best part is his head was all the way, you can't see me, but
It's like on a
tilt your
plane
head all
flight.
the way down. He was like that. And I was dying because he doesn't normally fall asleep during movies. So I turned over and
A
I was
boring one.
trying to take a picture of him, but it's dark in a movie theater and my phone had the auto flash on. So I think that's what woke you up. Was the flashing light.
Thank you.
Just wanted to let you know that.
You're so evil taking my picture. No,
And it didn't work out. It's just a black screen because I was scared. But yeah,
Should be scared.
so he didn't enjoy the movie because he
Hold your
fell
life in
asleep.
my hands.
Yeah.
Take her
So-
promotion back.
Do you ever remember the title
She's
anymore?
going to be the parking attendant.
Yep.
That'd probably be helpful. We have parking issues out here sometimes.
So do you have specific supplements that you usually recommend for anxiety, or do you just
I like Design Trail Pharma GABA. It's chewable. I'll chew one at night. They also have a thing called Insomnital Chewable that's got both melatonin and L-theanine in it. It's a good combination for me, at least. I don't know. It's just that I chew them both up and I'm out. Also take 9 milligrams of cheap melatonin off Amazon. You could also use, if you're young living, you could also, with the Pharma GABA for anxiety, if you can't turn your brain off at night, you can also use the Immupro. Chew that bad boy up with the Pharma GABA.
And what about kids?
Kids can take a fourth of a Pharma GABA easy.
Okay.
It's just a big chewable tablet. You can cut them up. So they
And you're
won't want
saying
it.
GABA, G-A-B-A.
Yeah, not gabapentin. That's weird.
Yeah.
That's big pharma. That's not good.
Yeah. So
for
you don't
use.
recommend anxiety meds. Try anxiety. Get your genetics testing, and try
I
supplements.
get a lot of patients, a lot of college students here because of BYU, University of Utah, and Utah Valley University. That's 140,000 college students. And I realize it hasn't quite returned to normal. Probably will be more so this fall, but the parents bring them in because they don't want them on psych meds. They don't want them on benzodiazepines. And that's what the medical clinics at the universities are putting these kids on, and they can send them to psychiatrists. Yeah, and your son's 21 and he's trying to get into law school, and he's trying to date. He's got to tell girls he's on all these psych meds. Doesn't go over real well.
No.
That's kind of not good. So
Yeah, I know. I went to church college, and if you had any issues with your period, the first thing they would do is put you on birth control. Like, it wasn't like see what was going on. It was just birth control. Which, someone asked about that. What's your opinion on birth control?
no. Birth control pills, no.
Yeah, how come?
Marina IUD, no. The shot, what's the shot called?
I don't know.
I can't remember. I never used it.
Yeah.
Because especially with the 85% of my patients probably have significant MTHFR issues, and the clotting risk is so high, it's not worth it. Plus the breast cancer risk. Plus those in my book, the breast cancer patient survival guide. I talk about those 2 studies that showed. I think it's also now in my progesterone book, but I may be wrong. That show that girls under 18 or under who are put on birth control pills, get this statistic on these. These were 2 big Northern European, Scandinavian studies. There's evidence so shocking with the first. It had another team in the next country over. I think it was Norway or whatever. They recreated the study and found the same data, that you have a 500+% lifetime risk of death from breast cancer. Not risk of getting breast cancer, but death from breast cancer. And I'm pretty sure the only way you can offset it that I know of, you just got to do everything possible. In my book, the Handbook A talks about diseases that you get. Breast cancer, I go through all the things that you can do to prevent breast cancer, but increasing your progesterone level, either using natural progesterones or making sure your level's always really good, not having any vitamin deficiency, stuff like that, can give you a 500+% decreased risk of breast cancer. That's from the American College of Epidemiology, 1981, a huge retrospective study they did. That data is still apropos, it's still appropriate. So,
Yeah.
but that breast cancer thing is real. That's why now we're getting a double peak breast cancer occurrences. The country used to be, when I started medicine 36 years ago, the peak age for breast cancer was 65. And now there's 2 peaks. It's bimodal. There's a peak in their 30s, I think it's 35 and 65.
It's crazy.
And that 35-year-olds those are the one that took birth control pills in their teens.
So sad. It's heartbreaking.
Yeah, but yeah, when they're trying to give away birth control for free, they were saying birth control pills lowered your risk for breast cancer. I don't know where that came from. Read any package insert for birth control pills. Even the Marina now has that huge. It's the same risk factor as the birth control pills. 250% increased risk of breast cancer
And the shot
with
was
the Marina or
called
birth control pills.
Depo-Vera.
Oh, Depo-Provera.
Yeah. Depo.
Yeah, Depot. Yeah, Depo.
I pronounced everything right.
Yeah.
This one's kind of an interesting one because
Am I going too long on these answers?
no, it's good. Any ideas on what to do for foot pain? Extreme pain in one heel, making it painful to walk, and pain in the front half of both feet. Doctor suggested it might be plantar fasciitis. I'm getting shoe inserts. Also, use a roller on my feet, or I'm going to get it.
If it's right, okay, there's a thing called first step pain in the morning. When you get out of bed, and that first step is agony, and it hurts right in front of. So here's your heel pad.
Do you want me to get my foot up there?
No,
I got socks on. I'll
So
put my
here's
foot up.
here's your foot. Here's the heel pad. And if the pain is right here, not back here, but right here, right in front of the heel pad, that's plantar fasciitis.
Good to know.
It is of the devil. I'll tell you what you do. There's 3 things I do for that. And you need to attack it really aggressively. And you're going to have a great deal of pain while they take care of it. But I do 3 things. One is it's called a Strasbourg sock. You can get it on Amazon. You start wearing it. You're gonna look like a funky Christmas elf who escaped from Christmas land with this weird thing on your feet. But it pulls your foot, it arches your foot back, so that stretches that every night. Also, in conjunction with that, you got to find a physical therapist in your area. Have your doctor refer you to them for E-stem, or go in and pay for the visit yourself. But make sure they really know how to do E-stem. Most physical therapists aren't very good at it. E-stem.
Hurts really bad though,
Yeah.
but helps.
And the third thing I would do is change your shoes. Big time, but you got to stretch.
You know what my mom does? Because she's always had plantar fasciitis. She wears high heels, and she
likes
swears by that.
but
Try it. It's worth a try.
I'm not going to wear high heels. But a
Come
New
on.
Balance is probably the best I've found for plantar
What about
fasciitis.
Your Hokas?
I like my Hokas, but
Not
but
with-
I don't know if they'd help with plantar fasciitis. Those are the 3 things you should do. And pray, because it can take 6 months to get rid of it. That E-stem, all I can say is hang on. And I'd put glutathione on the bottom of your foot when we come out with this new anti-inflammatory serum. You need to put a drop or 2 of that before you go and after you get out of the physical therapist's office, because their job is to disrupt the fibers in the bottom of your foot, the plantar fascia, which is like a bowstring across the arch of your foot. And man, is it agonal when they scrape it. You'll cry. But after they do that 4 or 5 times, and you keep wearing that sock, especially the days you have it done, it just realigns all your fibers and stretches them and gets you back to normal. Otherwise, it will never go away. It'll get tighter and tighter and tighter and tighter.
Yeah.
And the problem after you deal with all that, the next fun thing you get is iliotibial band syndrome. As we get older, our tendons and arches and everything tighten up. They don't get longer. They get tighter, shorter, crustier.
Cheryl Larson, you know her. She said, my patients also got relief wearing cowboy boots.
There it is.
I know
So-
for me, wearing something with a bigger heel, not necessarily dress shoes, but there's lots of good running shoes and other
Yeah.
things like the Hokas.
Yeah, lots of people were like, Hokas, I love them. Best thing. So there's a lot of help you can get. You just got to put in the work.
I would advise anyone who likes Hokas get on their email list, because when they do sales, and you can get the ones you like. I like the Bondies the best. They're the most cushiony for my heels.
That's a great segue for our sponsor. No, I'm just kidding.
Sunday. No. Next week, guys. No, I'm just kidding. He sponsors himself, basically. This is an interesting. What would you do for stomach ulcer and gluten intolerance in a 53-year-old female?
I would make sure you don't have C. difficile. No, not C. difficile, but H. pylori first, Helicobacter pylori. I'm not an eradicator. You're either an eradicator or you're not. I am for overpowering it with probiotics, like Life 9 or Nature's Healthy Trinity, or Garden of Life Raw probiotic for women over 50 or 40 or men or whatever. Yeah, I take the women's one too. I don't think there's much difference between the men's one, so my wife and I both take it. Also, I take designs for DGL Synergy, and they have some other things. Colostrum had designs for health to help heal your gut at night. There's a lot of things you can do. You may be put on, if it's bad enough, you may be put on like pantoprazole, which is Protonix, or some of the other medications like that. Prilosec. They're all over the counter now. There's a problem with them. It's kind of one of those things you can't live with and you can't live without. So I used to take Protonix all the time, and then I heard it blocks B vitamin absorption. Ouch, big time. It's a big problem. I get more patients coming in And when I really take them through their history, I find out that 4 or 7 or 8 years ago, when all their symptoms started, they also happen to have an ulcer, and they started on Protonics or Prilosec or one of those Zantac or Pepcid. Even those mild or earlier H2 blockers cause the problem. They all block B vitamin absorption, and they cause a really high risk of pancreatic cancer, which
Got
is a
dark
big deal.
fast.
What?
You go dark fast.
Yeah, it's bad.
Honest though.
So I may, if I'm really hurting, I'll take one maybe every 2 or 3 months. Otherwise, I try and manage that. Do it with Gaviscon tablets. I do it with DGL Synergy or DGL chewable tablets. I like the designs for health one, like I said.
We also have a really good YouTube video all about gut health, and we did a Facebook Live on it. So
We did.
always,
But also Pepto-Bismol tablets. I know they're old school, but man, they can really help. So yeah, be careful. Don't take Tums.
Mhm.
You know why you don't take Tums? Why don't you take Tums? So they're made with calcium carbonate.
I knew it.
And what does calcium carbonate have in it?
The lead.
Lead. 2003 JAMA big article. Every calcium carbonate on the market had tons of lead, literally tons of lead in them. Calcium, I don't know why they weren't pulled off the market with that information.
Wild.
Okay, quicker.
What about macular degeneration? Do you know?
Well,
Does-
what macular degeneration is supposedly from a lack of antioxidants, mainly. You know which one?
Glutathione.
Glutathione. Take lots of it.
What
See if you
about-
can reverse it.
What's the difference between dry and wet?
I don't know.
Mm.
But you can take antioxidants. Also, Young Living has Bright Eyes or Illuminize. Illuminize. Take that. If you're not Young Living, there are other versions on Amazon you can find. But also our bars are triglutathione. I won't say which one. You already know.
Sorry. This lady, she said she's always been really slim, but recently and suddenly seemed to lost all her muscle. She feels very bony and like nothing between her skin and her bones. NP just found out that she's producing very little estrogen and testosterone. She recommended pellets. Is there something else you would recommend?
I don't know how old she is.
Yeah, I didn't say.
Is she menopausal? That could explain where they all went to. Or is she premenopausal? Then she's probably malnourished, has vitamin deficiencies. Good nutrition. I'm going to say this every video. I think I said this. Good nutrition in equals good hormones out. And if you've got a bunch of spectre cell issues, you're not going to, intracellular vitamin issues, you're not going to make those hormones. I deal with this every day, all day long.
Well, this is something we haven't really talked about before, but a lot of people, when they hear good nutrition in, they assume they can eat all the good foods and be able to produce their hormones. So
I
why-
agree in theory,
yeah.
but the problem is you got curves thrown at you, and that you have genetic errors that are literally, like some of the in methylation errors I see, that you literally, to get enough B vitamins, you have to eat two whole beef cows a day. And so you can't do it. You just can't get that much B vitamin in.
Yeah.
So no, good luck. You're
Yeah.
gonna have to supplement.
I think it's a good thing to talk about. This has been something that a lot of people have been asking about, but Epstein-Barr virus, what can you do to help with the fatigue?
Glutathione. Lots of it. Will be usually gone in days.
Helps a lot.
Can we elaborate any more on
Nope.
that? Okay.
Nope. We've had patients in ICUs with severe Epstein-Barr deficiencies documented, and families thought they were dying. These people were really in bad shape, and we gave them glutathione and topically, because they couldn't swallow it, obviously, or couldn't put it in their mouth because they were comatose. And literally the next day they woke up.
Crazy.
It's extremely antiviral when done right.
Do you think Epstein-Barr virus is connected to MTHFR? That's a question I saw a couple times.
No,
So going on MTHFR, Renewander wouldn't really,
no.
because there was someone who asked that. What do you recommend for perimenopause? She has pretty bad anxiety at night, heart palpitations, racing heart, nausea upon waking, general feeling that her body is trying to kill herself.
Lots of progesterone. Get my little book, Progesterone, and read up on it. It's been number one on Amazon 3 times for a reason. Also, if it doesn't work, get a spectre cell. Next one.
What do you recommend for shingles? Do you recommend the vaccine or do you have a protocol?
Oh yeah, you should absolutely get the vaccine.
The dead stare.
Even though they admitted the last 2 officially did not work at all. You should definitely trust them now and get the vaccine because it's science.
And
oh, we are coming out with something new. Can I say the name of it?
mm-mm,
No.
mm-mm. We can just say that.
Okay, when will it be out, Jackson?
And hopefully we'll have our final bottle in this next week.
So this is our new pharmaceutical biotech company's first big product. It's spray on. It works really, really fast. Literally can be 1 dose and you get relief. 1 dose topically. It's all natural. Well, is it all natural?
Almost.
Yes.
99.99%. Yeah, it's all natural. And it's works really, really well.
Soothes
Also-
and renews the skin.
Yep.
Soothes and renews the skin. Yeah. And soothes and renews the post-herpetic neuralgia. Okay, I'm leaving that all
Soon,
on.
guys. Soon.
Yeah, because keep an eye on Facebook, and then also if you're not on our email list, make sure to go jump on the email list to get all the updates on that coming out very,
Because you
very
never
soon.
know when you have it or when one of your family members does. And a lot of you have have been involved in studies we've done with this or with similar type product to this, almost identical. And we're going to circle back to you and want favors. Here shortly. We'll give you favors, you give us favors. Okay.
Her husband has very low energy, 64. What testing and or
Spectre
supplements?
cell.
Just go straight to that.
I guarantee he's never had a spectre cell.
Probably not.
At 64. Yeah.
Sorry.
And then between now and about November 1st, he'd be really good. Well, I don't know. It's going to take 4 weeks, blah, blah, blah. Yeah. And we're waiting for tubes. What the heck?
2022. It'll be his year.
Uh,
No. I know that doesn't sound fun sometimes, but
that's
it
a
takes,
long ways away.
it takes time to get better though sometimes.
Then he'll be going to Disney World, dancing you around, riding all the rides with the grandkids. Are you kidding me?
That's Dr. Push's dream.
So I've done 5 spectre cells on myself over the years.
That's it.
It's a lot.
I feel like you've been
Every
doing
3 or
them
4 years, I get another one.
So that's a question people were asking. How soon should they get them? Depends.
It depends. If you're crashing and burning, get it now. But if it's only been 120 days or so, and you're still on your vitamin, I don't know. Usually by 120 days, everything's resolved. If it's not, repeat it then. We'll give you some little discount to help, but we don't have a lot of room to move on those, to keep up in those. We're trying to not increase our own price. So you notice we haven't increased our prices in years. Hardly anything.
Yeah.
Just because the economy is tough.
Is there any natural treatment for fungal sinusitis? I can't say.
No. No, if you got a fungal sinusitis, you got bacteria mind, trust me. They go hand in hand.
Don't you think you would get a microgen test, or would that not?
I would definitely suggest a microgen DX test to make sure. Because you're going to find a plethora of naughty little things growing in there.
Nasties.
It'll scare you.
It's not fun.
But you treat it appropriately. And yeah, you're going to have to use prescriptions. Yeah, you're going to have to use non-natural things. But guess what? Take lots of probiotics. Get it done, or it's going to eat a hole in your sinus in your brain and your head and kill you. I don't know that, but it's going to make you miserable.
Pretty doom
And yeah,
and
it
gloom.
could kill you.
Yeah, no.
You can get a fungal ball, which is bad.
That's a new word.
Yeah, it's a big fungal mass in one of your sinuses, and it's a nightmare.
Hey, this last week we were chatting with another physician, and he was talking about how he treats a lot of his patients that have mold problems. in their homes they have mold problems, or just wherever they're living at in the U.S. And he treats them with high doses of glutathione. Do you want to talk about that at all? I think I saw some mold questions in here.
You try it. I don't know anything specific about it. Sorry. I know a lot about. I think I know more about glutathione than almost any human on the planet. Obviously, especially physician wise. I just never looked at that. I know it's extremely antiviral.
Yeah.
We know that from lots of NIH studies. Just no one's ever had one that worked.
Yeah. Well, some other physicians are having success with it, so definitely something to try.
Yeah. Yeah, and we know a brand that works really well.
Well, and detoxing glutathione, that's what it does best. So detoxing from the mold makes sense.
Yeah.
Detoxing from the mold. No, you want to kill the mold.
Detox
You
it.
want to remove it.
Detox it.
One of my favorite things just about glutathione is I've had the chance to explain to a lot of people about it over the last couple of years. What's amazing with glutathione is that it just supports all the natural systems that your body already has in place for fighting off viruses, for restoring so many different things. It works on that molecular and cellular level in everything. In all the energy production, it's just there to keep everything flowing. And so using a truly functional and reduced glutathione changes the world for people.
It allows your body just to work better. It's all it's
Mhm.
doing. Yeah, it's not magic. It's
Fe-
just no
it
one's
feels
ever
like
done
magic.
it right before. We believe, as you know, Jackson, because you're over that company now, we believe that no antioxidant's been handled correctly.
Yeah.
Not one. That's saying a lot. That's a pretty problematic statement I just made.
Yeah. No, I love that discussion we get into all the time just about that. How will the world change when antioxidants are actually utilized correctly?
A lot.
Yeah.
Pretty amazingly. Well, you're going to see in the next few months now, right here, right now. Then we're just starting. So.
Yep.
Someone had a B12 injection with all the Bs apparently, and they became very anxious the next day. Does this mean that they might have overmethylated?
Yep.
Can you explain the symptoms of overmethylation?
It can be anxiety. It's often sleepiness and anxiety, or often just drowsiness. When I overmethylate, it's like I took 2 Dramamine that morning. It comes out kind of gradually over 3 or 4 days, or you get a shot like that, boom, you're there. And it's good she recognized it.
Yeah.
Problem is I'd keep, man, that's going to go on for days. Days. That's bad.
Yeah. Kind of going back to glutathione, because I've seen this a couple times. When people first start using it, or sometimes when they use it, they'll get achy. Do you think that has something to do with detoxing?
Yes.
Or pulling heavy metals out?
Yeah,
Or
FDA
something?
says it actually causes detoxing. So,
So kind of push through that, or lower
we
your
can say
dose,
that, yeah.
or what would you say?
lower the dose. Maybe go to 1 or 2 squirts a day.
Kind of work
Ease
your way up.
into it. Get rid of everything gradually. Well, we've been going a long time.
Yeah.
Okay. Give me one more question to it. Let's pick the winner.
Ooh. Let's find a good one. Okay, this is a good one. Sleeping. So many people have insomnia. They can't get to sleep. They stay up all night. They lay in bed. What do you recommend for sleep?
No nap. Avoid. So, got to do some preventative things first. Don't nap.
Dang it.
Don't take caffeine. Start avoiding caffeine. If you're taking any other stimulants, avoid them. Don't take your B vitamins or anything like that in the afternoon or evening. That's just the smart things to do. Number 1, pile on the melatonin. But as you know, melatonin is an antioxidant, right? Again, here we go again. We don't know. We don't know if it's been handled correctly. We don't think it has at all. So we're going to be playing with that in the next year. But try, if you're having a hard time turning your brain off, try GABA. Maybe get your genetics checked to see if you have a GABA problem. You know, a GAD1 or GAD2 or GAD3 problem. You can't make enough GABA because that'll give you a problem turning your brain off. I've started 7 businesses. I've written 30, I can't remember how many books, 30 books, whatever it is. And we're starting to biotech, and now we've got it going. I still have my medical practice. I don't make enough GABA, so I'm always going at it. So I have to get some downtime and turn my brain off at night. It's just the way it is.
Yeah.
Which drives me crazy, but it's the way it is because my brain does not go off. Which is good for a doctor because I'm always thinking of everything I missed or should have done, or it makes me a better doctor. Probably why I've never been sued for malpractice or anything like that.
Do you feel like any of those questions stumped you?
I'll let you pick the best one.
I've got a question that I don't know these words, so maybe it'll stump you. Can I ask that last one?
Yeah.
What causes lymphatic and glandular stagnation and can be completely reversed? To what level of debilitation do these conditions create in the human body?
Do you remember at that swim party in Arizona?
I wasn't there, but
Oh,
heard
Jackson
about it.
remembers.
Yeah, what was it?
And the one lady we looked at, and she had the bad lymphedemia.
Was that with their legs?
Yeah.
Yeah.
It's bad. It's really hard to reverse it. We think we found something. The thing we're coming out with in like 100 days does reverse it quite successfully. It's pretty amazing. But yeah, I don't know. There's not a really good answer for that because you could try wraps, you could try compression socks, support hoses, on and on. Lasix, all kinds of stuff to bring that down, but just nothing works very well. That wins it.
I thought that one
That was a
might
good,
stump
thought-provoking question.
you. Now I'm gonna have to go and find it.
And you know what we did with that lady, and it worked really well, didn't it?
Yes,
Oh,
it did.
Yeah, Kelsey was at that party.
Mm-hmm.
Yeah, it worked really well.
You're gonna have to talk a little longer because I have to go find her
Oh, yeah.
because it was from the post.
I mean, I want to talk a little bit about that product that's coming out.
Are you
And
sure?
I'm not going to say anything too specific, but just that be on the lookout for it. We have put a lot of thought and a couple of years of research and just development into this product, and we are just beside ourselves excited to get
It's
it
a
out
major market game changer.
there. Oh, it's going
And
to change
any
the
of you
world.
that use it, you're going to see that right away.
Yeah.
Yeah,
Not to be confused with the shingles product
Yes,
that is
that
coming
one.
out
That's in the
soon.
next week or so.
that's
but
a pretty specific
in the next
product.
couple months.
How many people search for? How many new searches for shingles occur every day?
Our marketing guys, they'd love to tell you all about that. It's I don't know about every day, but I think it was 900,000 monthly searches, new organic monthly searches for shingles and shingles relieving products.
And there's nothing that really works for it until now.
Yep.
Yeah, we're going to change that marketplace pretty dramatically.
Yep.
Again, all natural, super helpful, good for your eyes, your heart, your liver, your kidneys, all that. Really good for those, but yet it's extremely soothing.
Sounds very familiar to something else we know about.
Yeah, it's just a modification.
Mhm.
Yeah.
Yeah. So sorry to just be such a tease about all this, but
Rick, and you can't
Man.
find it.
Mhm.
we are excited.
Whoever asked the lymphedema, the lymphatic,
It was on one of your posts, and so
Question.
that's why I feel like I'm almost there.
Jennifer Edwards says it was her.
Jennifer Edwards. Is she our wiener?
There was a couple
Looks
people
like
were
it.
they were asking about lymphedemia, so we'll have to. I trust you, but we'll have to double check.
Okay, double check. So for right now, it's tentatively Jennifer Edwards.
Someone like her comments so that I don't lose it.
I will, Kelsey will be reaching out to you. We'll take shoulder that off Brecken. If you're indeed the person that first asked it, Brecken's going to find you. She's doing it now.
Yeah.
So, but I'm pretty sure it's Jennifer Edwards.
Yeah. I'll have to dig deep, but
Okay, dig
we'll
deep.
find
Why
it.
not confirm
One last
it?
thing, there were a couple people asking about IC specifically. We did a whole Facebook Live on it just a couple weeks ago, so go look through the timeline of our videos or on YouTube and go check that one out.
Yeah, so they think only 30% of people actually have IC that have IC, that have the diagnosis. 70% have chronic UTIs that haven't been properly diagnosed. And so that new genetic urine testing we're doing is really a game changer. Wow, I just got a result back on another one today. It's pretty shocking. Also for chronic sinus infections, that same thing. I did that on myself and it cleared up my infection. It's like peeling an onion though. you find 4 or 5 bacteria growing in there, plus a fungus, plus another yeast, plus it's frightening. That's from being in the hospitals too much and all that. So every doctor should probably have that done occasionally. But my chronic hoarseness went away. Now today I'm just thirsty, and it's still kind of dry and hot. Okay, I love you all. Thank you for listening. Sorry we went way over tonight. This is a really good one. Great questions. I hope I didn't blather on too much. Look for us in a couple of weeks. We'll do another one of these. And it's going to get more and more exciting as we come out with more stuff through our biotech. And we love you guys. God bless and go in good health.